Hi, my name is Neha, and my partner Pranjali and I will be presenting on the efficacy of brain-boosting supplements. I will first talk about Prevagen, and the active ingredient for it is apoquinone. Prevagen claims to be formulated with apoquinone, which is safe and uniquely supports brain function. They performed a study on those who were cognitively normal to mildly impaired. They had them take one Prevagen a day over 90 days. The results showed impairment of certain aspects of cognitive function. However, the study was not approved by the FDA. Prevagen is pretty well tolerated with common adverse effects of dizziness, nausea, and headaches. There shows to be insufficient evidence for the effectiveness of age-related cognitive decline. A study was done where older adults with self-reported memory claims took a 10 milligram supplement daily for 90 days. The results did not show improvement in verbal learning and only modestly showed improvement in delayed recall. Those cognitively normal also took a 10 milligram supplement daily for 90 days and did show improvement in verbal learning and delayed recall. There also appears to be insufficient evidence for the effectiveness of cognition, function, and memory. The Federal Trade Commission charged Quincy Bioscience with false and deceptive advertising. The company's study found that Prevagen was no more effective than a placebo at improving the 9 cognitive skills, including memory. It is believed that calcium dysregulation is related to age-associated declines in brain function. Elevated calcium levels lead to apoptosis of nerve cells. Calcium-binding proteins protect nerve cells from calcium toxicity. The mechanism of action of Prevagen is that apoquinone is a calcium-binding protein that is similar in structure to human calcium-binding proteins and could possibly reduce cell death. The pharmacokinetics of Prevagen is that apoquinone is a protein that is digested and metabolized into its constituent amino acids in the GI tract. It is unlikely that any intact apoquinone will reach the blood and the brain, and therefore not having an effect on those nerve cells. The next supplement I will discuss is Nureva, and the main active ingredients are neurofactor and SHARP-PS. Some background information on Nureva is that they claim to help fuel the 5 important indicators of brain health: fuel, focus, accuracy, memory, literacy, learning, and concentration. And the 2 active ingredients are derived from coffee and phospholipids. Neurofactor is one of the active ingredients and is derived from coffee. It is likely effective for mental alertness as consumed throughout the day and possibly ineffective for cognitive function for those who are elderly. The mechanism of action is that many of the alerting factors of caffeine may be related to the action of methylxanthine as an antagonist of the adenosine receptor. It has an action on arousal, vigilance, and fatigue. Its pharmacokinetics for absorption and metabolism is that caffeine levels in the blood are approximately 10-fold higher following consumption of caffeinated coffee versus decaffeinated coffee for 6 weeks. SHARP-PS is the other active ingredient in Nureva. It is a phospholipid called phosphatidylserine. It's possibly effective for age-related cognitive decline, improves memory and cognition. However, it is not known if plant-derived phosphatidylserine is beneficial. The pharmacokinetics of SHARP-PS is that for absorption in animals, it can be found in the blood within 30 minutes of oral intake, and for distribution, animal research shows that oral intake results in accumulation of phosphatidylserine in the brain and liver. Phosphatidylserine is the most abundant phospholipid in the human brain. It is important in nerve membrane functions, such as maintenance of the cell's internal environment, secretory vesicle release, cell growth regulation, signal transduction, and cell-to-cell communication. As one gets older, phosphatidylserine declines with age, and researchers believe that abnormal nerve functions can be attributed to changes in lipid composition of the brain. Administration of phosphatidylserine might normalize the brain lipid levels and bring nerve function back to normal.
Hello, my name is Pranjali, and the next supplement I'll be talking about is Ginko Biloba, which comes from a plant used in traditional Chinese medicine. One of the companies called Nature's Plus makes these supplements, and their claim is as follows. Looking to help your brain keep up? Ginkgo has long been prized in Chinese and Japanese herbalism. That's why Nature's Plus offers Herbal Active's extended release Ginkgo Biloba. It's where time-honored tradition and modern research meet. Supports healthy brain function and promotes optimal circulation within the brain. It is important to note that these statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. This product also contains 120 milligrams of Ginkgo biloba. It has been standardized for consistent activity. It also comes in sustained release for superior absorption. And this particular product from Nature's Plus contains 60 servings per container. In terms of effectiveness, Ginkgo biloba has proven to be possibly effective for anxiety, dementia, hearing loss, premenstrual syndrome, schizophrenia, stroke, tardive dyskinesia, and vertigo. It is proven to be possibly ineffective for things like age-related cognitive decline, antidepressant-induced sexual dysfunction, cardiovascular disease, chemotherapy-related cognitive impairment, hypertension, multiple sclerosis, and tinnitus. In terms of absorption, the bioavailability of some bioactive ingredients like ginkolide A and B is greater than 80%. In terms of elimination, it is eliminated in the urine as a glucuronide. Half-lives of ginkolides A and B are around 4 and 6 hours, respectively. Applicable parts of the plant of Ginkgo biloba are the leaf and the seed. The leaf is most commonly used as an extract. Leaves and extracts contain active constituents like flavonoids, terpenoids, and organic acids. Majority of the leaves and the extracts are flavonoids, which is about 24 to 25%, and 6% terpenoids. Major flavonoids are derived from flavonoid rootin, which include isoarhamnetin, quercetin, camphorol, and proanthocyanidins. Primary terpenoids include glycolides A and B. Many of the constituents have individual pharmacological effects, but when combined, they are even more potent. In terms of drug interactions, Ginkgo biloba has either major or moderate ones. The major drug interaction is with telenolol, which is a beta blocker. Ginkgo can increase blood levels of this drug. Ginkgo has moderate interactions with Xanax, anticoagulants like warfarin, anticonvulsants, antidiabetics, atorvastatin, cytochrome P450 substrates, ibuprofen, P-glycoprotein substrates, risperidone, Zocor, trazodone, and seizure threshold lowering drugs. The next supplement I'll be talking about is called NoQ. This company claims that this product has been crafted with the help of some of Europe's top neuroscientists and combines 13 science-backed natural ingredients to support brain pathways for boosted problem-solving skills, reduce feelings of brain overwhelm, increase motivation to finish projects, improve razor-sharp focus, enhance memory, and lower stress levels. Again, it is important to note that these statements have not been evaluated by the Food and Drug Administration. These products are not intended to diagnose, treat, cure, or prevent any disease. As claimed before, the 13 ingredients are as follows. Glutamax helps improve brain health, attention, focus, learning performance, sleep patterns, and naturally promotes a stronger eye-brain connection while protecting neurotransmitters. It also helps combat oxidative stress that stems from blue light exposure. Bacopa monnieri, which is one of the major ingredients, crosses the blood-brain barrier and binds to receptors that may assist with the ability to process difficult information with ease without feeling overwhelmed. Cuperzia serrata helps slow cognitive decline and improve brain functions, including memory, focus, and attention by supporting an uptake of acetylcholine in the brain. Acetylcholine is a neurotransmitter that helps with reasoning abilities, concentration, and forming new memories and help grow new brain synapses. Terstilbene is found in blueberries. It is good for memory, learning, and protecting brain against cognitive decline. Resveratrol is found in red wine and has natural anti-inflammatory properties. It keeps brain function at optimal speed. L-theanine is an antioxidant that is found in tea, which helps lower feelings of stress while increasing concentration, memory, and alertness. L-tyrosine is an amino acid that helps support dopamine, which helps lower stress, improve focus, boost memory, and concentration. Alpha-GPC contains acetylcholine, which might help boost brain supply of acetylcholine. It could also help improve memory, boost attention, increase clear-headed focus, and enhance mental clarity. Oat straw extract reduces symptoms of stress, relieving the occasional feeling of anxiety, and helps boost memory, concentration, and attention span. Cat's claw may help reduce brain plaque that causes memory loss. It can also help reduce symptoms of brain fog and increase memory retention and promote cognitive functions. Vitamin B1 supports nerve health, muscle growth, and energy production. Vitamin B7 is also known as biotin, can help support a healthy nervous system, cognitive function, and help improve memory and overall mood. Vitamin B12 may help prevent damage to neurotransmitters, improve mood, and boost energy levels. In terms of effectiveness, tyrosine has been proven to be possibly effective for cognitive function and memory. There is, however, insufficient reliable evidence to prove that Bacopa monnieri helps with Alzheimer's disease and cognitive function. Tyrosine helps with dementia, depression, schizophrenia, sleep deprivation, premenstrual syndrome, and resveratrol helping with cognitive function and cognitive impairment. In terms of absorption, some things to keep in mind is that taking supplements that contain resveratrol with food can cause a delay in reaching peak plasma concentration levels, but it is questionable if there are any pharmacologic effects of this. Plasma levels are higher for a given dose of tyrosine in adults over 60, and that is probably due to a lower first-pass metabolism in the liver. In terms of distribution, in animals, resveratrol increases in heart, stomach, liver, and kidney. It is delivered to tissues through lipoprotein interactions. And tyrosine is transported across the blood-brain barrier by LNAA transport. In terms of metabolism, very small amount of resveratrol is absorbed, but higher amounts of its metabolites could be found in plasma. They might be glucuronidated in the liver and the kidney. Tyrosine is converted to L-DOPA, dopamine, norepinephrine, and eventually epinephrine, which means levels of these could increase following administration. In terms of excretion, in low doses, resveratrol is excreted in the urine within 24 hours. Tyrosine increases levels of norepinephrine, epinephrine, and dopamine in urine. In terms of mechanism of action, the bacopa leaves and fruits are applicable parts of the plant. It has anti-epileptic, antifungal, and anxiolytic effects. There is some evidence for neurological effects that suggest that it may facilitate learning ability, memory, and cognitive performance through acetylcholine release, acetylase activity, and muscarinic cholinergic receptor binding. Tyrosine also has antidepressant and anti-stress effects due to it being precursor for catecholamines, dopamine, epinephrine, and norepinephrine. And that's all we have for you guys today. Thank you so much.